Hello, my name is Kelsi Batioja, and I am a second-year medical student at Oklahoma State University College of Osteopathic Medicine at the Cherokee Nation. And today I'm going to be presenting to you the evaluating of reporting of patient-reported outcomes in surgical management of stress urinary incontinence. So stress urinary incontinence has been shown to significantly reduce a woman's quality of life with both the financial and emotional burdens that it can impose. And quality of life is able to be assessed through the use of patient-reported outcomes. And this use of patient-reported outcomes in randomized controlled trials is increasing because they provide patient-centered data. Thus, standardization of the reporting is paramount. So our objective was we aim to evaluate the completeness of reporting of randomized controlled trials for surgical management of stress urinary incontinence in females based on the adaptation of the Consolidated Standards of Reporting Trial Statement with the patient-reported outcome extension, so Consort Pro. We also aim to evaluate the same included randomized control trials for risk of bias using Cochrane Collaboration Risk of Bias Assessment Tool. So first, we conducted a literature search and returns were screened using RAN. So we had a total of 7,820 records were identified via RAN. After those were identified, we title and abstract screen. We removed 2,910 duplicates, leaving 4,910 unique records screened. We excluded a lot of those, and only 98 records were full text screened. And after full text screening, we had 43 studies included for data extraction and analysis that met our inclusion criteria. So the RCTs that met the inclusion criteria were evaluated with the adaptation of the Consort Pro extension checklist, as well as the risk of bias 2.0. Completion percentages of Consort Pro were calculated, and we also used a bivariate regression to evaluate associations between trial characteristics and the Consort Pro adaptation completeness. So in result, 43 of the RCTs that were included for data extraction and analysis with the mean completion percentage of our Consort Pro adaptation at 50.53%. A total of 38 or 88.37% of these studies received a ROB 2.0 rating of some concern. Also, randomized controlled trials with a follow-up longer than 3 months had higher Consort Pro adaptation completion of statistical significance at the 3 to 6 month range, the 6 to 12 month, and greater than 12 months. Reporting a conflict of interest and reporting no conflict of interest also had statistically significant results, with higher reporting completeness when compared to studies without a conflict of interest statement at all. So in summary, the use of patient-reported outcomes provide an objective assessment of the patient's subjective symptoms and can influence clinical decision-making within patient-centered care, because those patient-reported outcomes help physicians to better understand a patient's experience with the condition. So the completeness of reporting in stress urinary incontinence through the Consort Pro adaptation was suboptimal in the surgical management. So improving reporting completeness through better adherence to the Consort Pro adaptation can allow for more informed clinical decision-making and therefore improvement in quality of life. Thank you.